bring you those effects in just a moment. In fact, it's day 76 of the lockdown, and academics are now questioning whether interventions to curb the spread of the coronavirus were in fact based on reliable modeling and whether the lockdown has been successful in, quote, flattening the curve, so to speak. So the University of Johannesburg's Dr. Sean Muller says predictions on the extent of infections and deaths are not only flawed, but could also have major social, economic and health consequences. Dr. Muller now, as you can see, joins us via our Skype line. Doc, thanks very much for your time and welcome to the AM report. So, models by their very nature are going to be always wrong, at least to some degree. That considered, what makes the COVID-19 models particularly problematic?
Good morning and thanks for having me. Well, there are two issues here. The one issue is about the models that the government originally used to make its lockdown decision. And the second one is about the general limitations of models in this particular context. So the thing is that President Ramaphosa, when he announced the lockdown, emphasized the modeling that the government had done and said that that informed the decision to implement a strict lockdown. Now, those models have never been released, and the projections that they made have never been released. There was a media report a few days later, which gave an indication that the projections suggested deaths of between about 87,000 and about 350,000. And one can understand why the government reacted then the way that it did. But a chair of the government's ministerial advisory committee, one of the subcommittees involved, has criticized the models as being flawed and based on very simplistic assumptions. So the concern is perhaps that the government overreacted in the way that it initially responded to the pandemic, and now, having exhausted our economic and social resources, is lifting the lockdown not because it thinks it's the best thing to do from a public health point of view, but because it literally has no choice.
That's interesting you say that, because it doesn't appear the World Health Organization agreed. I mean, at the beginning of the pandemic, or at least the lockdown here in South Africa, the health minister and the government were receiving all kinds of praises. Did they too get it wrong?
Well, it's interesting you should say that, because I'm busy doing some academic work at the moment, and I went looking for some of that praise that was reported in the media, and it was very hard to find. It was mostly comments in passing made by the World Health Organization. And in fact, if you look at a recent report the WHO released, they classified South Africa's preparation for the pandemic at level 3, along with countries like Tanzania, which have had pretty poor leadership in terms of using evidence and using scientific advice, and below a country like Brazil, which is at level 2. So when you actually look at how the WHO has classified our preparedness, it really isn't very good. I think what happened early on is that many people, the media, yourselves included, were just happy that the government was acting with good intentions, it was trying to take the best advice available, and it was willing to be decisive. And, what I say in my article is that I personally don't have any doubt of the government's good intentions, and there's no evidence, as far as I'm aware, that the government didn't have good intentions. But the thing is, in public policy making generally, good intentions are not enough. And in situations like this that are highly complex, we're dealing with a virus, the properties of which weren't really well understood, and evidence was being used from other populations, which are not just different to ours, but their evidence itself has been revised significantly since then. So there were lots of reasons to be a little bit more cautious, and unfortunately, even though the government may have had good intentions, I think it had excessive confidence in the evidence that was available to it at the time, and perhaps didn't think far enough ahead in thinking about the resources that we would have available if they implemented a strict lockdown immediately.
Yeah, so a quick Google search, Dr. Michael Ryan from the World Health Organization, who is the organization's Health Emergency Program Director, on the 27th of April said, and this is a direct quote, right? South Africa has used its initial lockdown very well and has put in place a 4-point plan for preparedness and response. The deployment of 39 mobile laboratories has been a huge innovation and has training community healthcare workers for contact tracing. So that to me sounds like a pretty explicit thumbs up, for lack of a better term. And so when you say that
right,
you struggle to find ways through which the World Health Organization might have done this, some people might wonder what you mean by that, given this very explicit quote.
Well, you see, the thing is, how are we measuring success? So in the article that I've written, I've actually measured success against the government's own approach and using its own models. So the government, if we give it the most generous interpretation, is it's attempting a strategy of mitigation, which is to contain the rate of spread of the virus through the population to prevent it from exceeding our healthcare capacity. And the purpose then of the lockdown was really to prepare the healthcare system and increase its capacity so that we could handle a greater number of critical care cases. Now, the government's own models that it's released recently, now bear in mind these are different to the earlier ones, which have never been released. The recent models suggest that we could have a peak of about 20,000 critical care cases, and only with about 4,000 critical care or ICU beds. Now, that 4,000 is very similar to what existed before the lockdown. Okay, from various estimates that I've seen, again, including the government's own modelers, right? So the most influential model of the pandemic that's caused governments to implement the strict lockdown is the model that was done by some modelers at Imperial College in the UK. And of course, it's problematic that the developing country governments have been relying on that model because it doesn't reflect aspects of our own societies. But the argument in that model was that flattening the curve means reducing the number of critical infections below your critical care capacity. That's how they define flattening the curve. Now, remember, the governments use this term flattening the curve a lot. They roll it out all the time. Okay? Now, what I'm saying is that the government's own modeling shows that it's failed to significantly increase our critical care capacity. And that is what flattening the curve, that's how it's defined. So by their own measures, their own models, their own measures of critical care capacity, and their own terminology of flattening the curve, they failed. So that's the first point. The second point is that the World Health Organization released that report that I was talking about preparedness. I think it was on the 27th of May. So that's a month after the quote that you're referring to. Now, the quote that you're referring to is, there's nothing in there that I think I would disagree with. The government has tried to be innovative. We have our healthcare system is in many ways more sophisticated than many other countries on the continent. Our laboratory testing capacity in particular is much greater both in sophistication and in size. But that still doesn't mean that the lockdown was the best policy, and it doesn't mean that we're necessarily going to have any fewer deaths than if we hadn't implemented the lockdown. And it's important to say, when I say that, I'm not saying the government shouldn't have done anything, of course not. But the government had already implemented a number of very sensible measures before it implemented the strict lockdown. And furthermore, after it implemented the lockdown, it could have lifted it earlier. And it seems that there are even scientists within the government's advisory committee who argue that that should have happened.
Interesting insights indeed. We're going to have to leave it there. Thank you very much for your time. Dr. Sean Muller is with the